The Centers for Disease Control and Prevention, CDC, interim leaders held their first all-hands meeting, focusing on myth-busting and enhancing resilience. In a bold move, they unveiled a brand new spin-off entity from the CDC, the Administration for a Healthy America, with no specifics other than it will assume some CDC functions. The June 17, 2025 agency-wide meeting was the first since the Trump era. Susan Monarez, pending confirmation as director, is a holdover from the prior administration and was meeting with senators. The meeting addressed the Advisory Committee for Immunization Practices, ACIP, controversy, staff morale and leadership updates with a tightly scripted and civil approach. The meeting agenda focused on personnel changes, court case statuses affecting layoffs, and the transition of some CDC functions to a new entity, Administration for a Healthy America, as announced by Kennedy. The CDC employs approximately 13,000 full-time staff, including scientists, public health advisors, and medical officers. Additional contractors and temporary staff can increase the workforce to over 15,000 at peak capacity. In April, 2,400 employees were laid off, with 800 reinstated. There were 500 voluntary retirements and resignations, and 400 deferred resignations due to restructuring. These numbers are small relative to the agency's 15,000 members and are not a massive layoff. Susan Monarez, the CDC director nominee, is meeting with senators ahead of her confirmation hearing. The agency is hopeful for a late June hearing, with confirmation expected in summer 2025. Key events include the start of layoffs on April 1st, the removal of ACIP members in early June, and a staff memo on June 17th. The next ACIP meeting is scheduled for June 25th to 27, with Monarez's confirmation expected in the summer. In conclusion, the new CDC director is not an outsider. The first staff meeting was non-contentious, revealing small layoffs relative to the agency's size. Director confirmation is pending, and a new entity will assume some CDC functions.